No one country or organization can fight HIV alone, as it is a global health crisis with hydra-headed ramifications on all aspects of our lives. Only through effective collaboration and partnerships can we win the fight. This is The Last Mile with NACA, and I am Adesu Suyi. Welcome. NACA was established to facilitate and coordinate the multi-sectoral fight against HIV in Nigeria. The agency collaborates with and ensures collaboration among numerous stakeholders to achieve its mandate. As you may have guessed, this episode is on collaboration in the fight against HIV. Keep watching.
The human immunodeficiency virus, HIV, is a global development crisis with profound socio-economic and security impacts. Hence, the development and engagement of strategic partnerships among private sector peers, governments, civil society, faith-based institutions and individuals is vital to ending the disease. In Nigeria, the National Agency for the Control of AIDS, NACA, is charged with coordinating this multi-sectoral response in fighting HIV.
Generally, the HIV response, the fight against HIV globally, has been multi-sectoral. And nationally, it has been so for the last 2 decades. That is why the agency was placed under the direct supervision of the presidency, because it requires the input of multiple ministries and institutions whose services that are very critical, to fighting the epidemic to the end. Recently, it has been tested for COVID-19 response, and it has turned out to be reliable and very helpful. Without their collaborative support, the fight against COVID would have been very, very difficult. So this is the same that has been happening with HIV response over the last 2 decades. And I'm happy to say that this multi-sectoral approach has worked very well.
At the federal level, NACA collaborates with the National AIDS and STDs Control Program of the Federal Ministry of Health.
Most of the hospitals where we provide services, that belong to the federal government are under the Ministry of Health. And if you look at the state hospitals where you provide services, Ministry of Health has linked with the state Ministry of Health, and these services in terms of service coordination, the treatment coordination, what is being provided at facility, we get a unit in the Ministry of Health that is helping NACA to coordinate that across facilities nationwide.
NASCAP is actually a program, so it's a division within the Department of Public Health in the Federal Ministry of Health. Now, before you can get to the point where you either test people or put them on treatment, it's a cascade, it's a journey, so to speak. So you start with prevention, primary prevention, a lot of which comes under the role and scope of what NACA delivers directly, before you then get onto treatment and, of course, the other parts that relate to care. So it's one long journey which should be seamless, and that's where you see collaboration a key element in doing it. And so NACA has really been key to taking that, sort of bringing everybody together, ensuring that everybody's talking to each other, and elements like the program, the HIV program in the Ministry of Health, of course, bring on board those elements that are our own primary responsibility, and then together we can hope to push towards the last mile, which is what we're all headed for right now.
The United States, the Global Fund and UNAIDS have been an integral component of its war on HIV and AIDS in Nigeria.
Nigeria is now one of the countries that are at the forefront, and the global community is watching Nigeria keenly, because we have the potentials of controlling HIV within the next 2 years. The tremendous work that was done in the last 3 years has brought Nigeria much closer to controlling HIV. And this is a joint work, collaborative work that was done with U.S. government, PEPFAR program, the Global Fund, who are the major partners and financiers, of the response in terms of service provision, and the United Nations programs, HIV, UNAIDS. All these are key and critical institutions, and they have been very, very supportive, very, very helpful in seeing our national response to where it is today.
The working relationship has been cordial, especially now in the years with the current DG NACA. The relationship has really, really improved. You can see NACA is the only principal recipient that is handling 3 grants from the Global Fund. This is trust. Without trust, Global Fund will never do that. So we are very proud of the DG and the NACA team for making us proud, because this is Nigeria. So we are telling people that we are different, right? So we have very good relationship, and it's our hope that the support they are giving us, we are going to use them judiciously and in a transparent manner, that's what we are preaching, and that's what the DG is preaching. And that's what will motivate the Global Fund to continue to partner with us to support the people of Nigeria.
I see my office here more like an extension of NACA. So we work well together, we think together, and we act together. And the biggest area of contribution, an area we feel exceedingly proud to have worked with NACA on, is on the issue of data. For the longest while, we really were flying in the dark in Nigeria, not knowing how heavy this burden of HIV is. So it was a thing of joy that we were able to work with NACA to mobilize our development and donor partners, particularly the American government. I will keep talking about the American government, PEPFAR, and Global Fund, for about $100 million to be spent to conduct the largest HIV survey ever done anywhere in the world in this country in 2018. It's called the NICE, Nigeria AIDS Indicator and Impact Survey. It's the most amazing thing that has ever happened in this country. It's a game changer. It was launched by His Excellency the President, and since then we have revised strategies of how to fight HIV in this country, and we're winning because of that collaboration. There are many others.
The civil society also plays critical roles.
Now, if you go to the community, there are key collaborators that we work with to address these issues, where we feel they are showing up and they are contributing, to the rate of HIV acquisition in these localities. In that area, we have civil society organizations that we work with that will enable people to access our services, both preventive services and treatment services.
NEP1 being the major primary constituency within the community of people living with HIV. We have always strengthened our relationship with NACA, being the government agency, in terms of providing protections and also guidance for policy formulation, and of course advocacy to ensure international and national partners also collaborate and partner with us effectively. Majorly, NACA is a coordinating entity, so they don't really involve into implementation, but rather they coordinate. So in most of the coordination, we are actually part of it. Recently, we conducted the stigma index survey. The DG NACA, he served as the chair of the steering committee. So that's how it has been.
To ensure the multi-sectoral response across the country yields the desired results, NACA established zonal offices.
Over the last 1 or 2 years we expand our presence. We had before then one single office located here in Abuja, but now we have 6 additional offices located, 1 in each of the 6 geopolitical zones, to enable us come close to what is happening at the community and facility level, to see what our collaborators are doing, the kind of services that are being provided, the quality of services, and also work and mobilize the individuals. These are the patient community, work together, monitor services together, and this is what we call community-led monitoring. The community that receives the services, now leads in monitoring the activity, that are meant for them. And now they give us testimony in terms of quality, in terms of access, which are all very important. And above all, stigmatization, discrimination, and professionalism of the people that are providing the services.
All hands must be on deck, as ending HIV in Nigeria is bigger than any one organization or community.
Each one of us has his or her own part to play. It's a collective responsibility. So we need to cooperate. All hands need to be on deck to get this thing done. We receive this support from international donors. That doesn't mean we are always going to receive it. So from our own end here, under NACA and other institutions, we are working hard to ensure that all the resources that are received are well utilized, so that we know that we are going to build strong legacies, that even when the funding is not coming from international donors, we will look back and say, oh, we are able to do A, B, C, and so on. So we all have roles to play.
We're at the point now where we need everybody to come, lay their hands on the plow and push towards the last mile. And collaboration for us does not just mean government actors. It means civil society actors. It means community actors. And of course, for a disease like HIV, you cannot talk about HIV without talking about individuals. It also means for us that individuals need to take their own action. And one of the primary things that our expectation from individuals would be is in terms of getting a test to know their HIV status. We cannot get to the last mile if everybody who is positive does not know their status and does not take advantage of services that have already been made available.
The federal government creates an enabling environment, creates policy, is supportive, So in that regard, there is a wonderful agreement that has been reached by the federal government and the state that up to 0.5% to 1% of the state budget should be allocated to HIV, and be used to procure drugs, test kits, reagents, and whatever is needed to prosecute the response. But not all the states are complying. But it's not only the government alone that must fight HIV. Private sector. Look at what happened with COVID. The Nigerian private sector rose to the challenge. COVID in Nigeria may have raised more than $70 million and done so many things at the state level. We want private sector in Nigeria to do the same thing for HIV.
People living with HIV should not be discriminated and then should not be stigmatized. They should be treated continuously like every other member of the society, and people should continue to listen to this campaign and always be willing to learn about HIV so that they will have better information about it and also informed decision where necessary.
The call here is for all stakeholders to maintain the current momentum. We shouldn't take our feet off the pedal until that time is reached. So we have 2 phases of work. One, control the epidemic, which we're at the verge now of controlling. And the second one, sustain the control. And that is not easy, but we're doing our best to see how we get help from the states, to see how federal government continue to invest, and to see how we continue to get support, no matter how small it may be, from our big donors by the time we reach that bridge and cross it.
With genuine partnership and effective collaboration, we can end the HIV epidemic together.
Much work has been done in the fight against HIV/AIDS in Nigeria. However, more work needs to be done. Together, we can end AIDS by the year 2030, even amidst coronavirus pandemic.
Educate yourself. This is crucial in the fight against HIV and AIDS.
Get tested. The only way to know for certain your status and stop the spread.
Get involved. People with HIV and AIDS need care and support.
Say no to stigma. Stigma prevents people from getting tested and those living with HIV from treatment.
Spread the word. The more we educate others about the disease, the better we can fight it.
Adhere to COVID-19 prevention protocols, wear a face mask, and maintain physical distance in public places.
Remember, only united can we defeat HIV to finish and end AIDS by the year 2030. Get tested today. Let's fight HIV to finish in Nigeria.
NACA update is next. Don't go away.
State agencies for the control of AIDS, SACA, are created to mimic the structure, function and mechanism of the national body, NACA, but are limited to coordinating the HIV response within the states. The project manager and secretary of the Kwara State AIDS Control Agency, Dr. Alabi Salim, speaks on the state's peculiarities.
First and foremost, we should understand that Kwara State is a transit state. It's a junction state that connects the northern and the southern part of the country. And because of this, we have some peculiarities that we need to factor in. There are several junction towns and villages that are located and situated in Kwara State, especially in local communities, in interlands, places where goods and commodities transit from the northern part to the southern and also from southern back to the northern part of the country. And because of this, we are even seeing programmatically that we are having different KPI typologies. We have female sex workers that are found in some strategic areas in the state. Men who have sex with men are also available there. We have injection drug users and so many other things like that. Beyond being a transit state, Kwara State also happens to be a border state. We share several local borders with adjoining states. We share borders with Ekiti State, we share with Oyo State, we share with Niger State, we share with Kogi State. Again, we even share an international border with Republic of Benin. All this plays a very big role in the epidemiology and the spread of HIV within Kwara.
Dr. Salim also spoke on the state agency's challenges.
I'll say that we've not had it this good in recent times. We have very strong political will, we have very strong government support. However, we know that government cannot do it alone. So there is a lot that external individuals, external partners, donor agencies can do to bridge the gap in HIV intervention in the state, to also support or to add to what the government of the state is doing for us presently. We have 16 local governments. We don't have partner presence in about 44% of our local governments. About 7 of our local governments do not have partner support. This is a very big gap. Again, we have issues of staff attrition. On that end, there are a lot of efforts that we have made as an agency. Speaking with the office of His Excellency, who happens to be our chairman, the deputy governor of the state, we have paid several advocacy visits to sister agencies, to ministries that we second officers from to come and assist us in the agency. And we hope that in the future, that is very close to us, the issue of staff attrition will be a thing of the past, after we must have been able to really get things in place and really have a proper understanding across board.
A team from the Kwara State AIDS Control Agency office in Ilorin drove 4 hours to Patigi local government area. The team carried out screening and counseling services to a number of people who required intervention on HIV and other diseases. Residents of Patigi were also sensitized on preventive measures on HIV and AIDS. They were advised against sharing of sharp objects and the need to use protection during sexual relations. Some beneficiaries thanked the agency and the government for the intervention, stating it would go a long way in improving their quality of life.
Sister! Where you dey rush dey go like this now? Take am easy now.
Na hospital I dey go to do HIV test.
Na everything you dey do HIV test. Before you carry belle, you do HIV test. Now you dey rush go do another HIV test. Wetin you dey find, you go see am o.
No be so, my sister. HIV test no be bad thing o. Na make I know my status so that no matter the result, my pikin no go get HIV.
HIV fit pass from mama to pikin?
Yes o. During pregnancy or labor or even when we dey breastfeed the pikin. Yes, and my husband dey road dey come sef, he go meet me for hospital. We go do the test together.
Hey, your husband na man he be. But wait o, una no dey fear. What if the result come out positive?
Fear wetin na? HIV no be death sentence. And medicine don dey to take manage am. See, nowadays people wey get HIV, they live their life normal like everybody else.
You sure say I no go follow you go do my own so?
Wetin you dey wait for now? Come make we go jare. With quick action, we fit stop this HIV waka from mama to pikin. Go do your own HIV test today.
What we want people to know is that there is an act against HIV stigma and discrimination. And the act has two components. There is the jail component, there is the fine component of it. So it can be both, actually, depending on the gravity. People with HIV live normal life. They work as productive as any member of the community. And among them are intelligent people, hardworking people. Why should we discriminate against them? If we stigmatize people and we discriminate, it puts them away from our hospitals. It prevents them from coming to our facility to know their status. It prevents them from coming to our facilities to take these medications that are very helpful. So stigma is a number one enemy for us in fighting HIV disease and in controlling HIV disease. And we will be all out against it.
For more information on HIV and AIDS and related diseases, or to report suspected cases of stigma and discrimination, violence and human rights violation, please call the National Call Center, toll-free on 6222. Reach us via social media at National Call Center or email callcenter@naca.gov.ng and visit our website on naca.gov.ng. Thanks for watching, and as always, continue to support the HIV response. Do not stigmatize or discriminate people living with HIV. Avoid indiscriminate sex. And lastly, know your status and take action. Till next week on The Last Mile with NACA, I am Adesu Alsui. Goodbye.